Ever found yourself awakening to a throbbing jaw? You might be experiencing an uncomfortable condition known as bruxism, or teeth grinding, a health issue that pervades people's lives worldwide. This dilemma is not only common, but insidiously affects the quality of life of millions, silently and unbeknownst to them. As the sun rises, they find themselves greeting the day with a painful jaw, clueless about the reason behind it. The discomfort is akin to a nagging pain, a persistent ache that is hard to ignore. Imagine waking up expecting a fresh start to the day, but instead you're haunted by this relentless, throbbing pain. Today we delve into one story. This is the story of our friend Faith, who was brave enough to share her plight with us. Faith, a vibrant woman in her mid-30s, had always been a healthy individual, taking immense care of her well-being. But recently, she found her mornings tainted with an inexplicable, agonizing pain in her jaw, leading her to suspect that she might be grinding her teeth during sleep. It was the constant, dull pain that first alerted Faith to the issue. She began to notice the sensation becoming progressively worse, turning her otherwise bright mornings into uncomfortable episodes. Concerned, Faith decided to seek medical advice. She reached out to her dentist, Dr. Clarissa, an experienced dentist with a reputation for her thorough and compassionate approach toward her patients. Faith: recently my mornings have been marred by jaw pain. I suspect it's due to teeth grinding during sleep. Dr. Clarissa, upon hearing this, expressed her concern and immediately suggested a thorough examination of Faith's teeth to pinpoint the problem. Dentist Clarissa: that could be the case, Faith. Let's examine your teeth. With a keen eye and steady hand, Clarissa set out to analyze Faith's condition. The room was filled with the subdued hum of the dental equipment, the stark white walls a stark contrast to Faith's unvoiced. After an intense examination, Dr. Clarissa leaned back, her expression serious. She looked at Faith, her experienced eyes bearing the news. The diagnosis was not completely unexpected, but it was concerning nonetheless. Dentist Clarissa: there are evident signs of grinding on your teeth, Faith. Although it's not severe, it requires immediate attention before it escalates. And so, Faith's story, like many others, sheds light on the pervasive issue of teeth grinding. A subtle yet significant problem, one that demands attention and care before it evolves into a severe concern. This narrative is a reminder for each of us to pay attention to our bodies, to listen to the whispers before they become unbearable screams. Teeth grinding can result from a variety of contributing elements, each one uniquely impactful. The most commonly recognized factor is stress. When we are overwhelmed or anxious, our bodies react, often unconsciously. One of these reactions is the grinding or clenching of our teeth. Various life events can exacerbate this, such as work-related stress, financial worries, or personal conflicts. This is not to be dismissed as a trivial issue, for it can cause severe discomfort and long-term damage to your oral health. Anxiety, another psychological condition, can also lead to teeth grinding. It's a chronic state of worry and fear that can consume a person. This condition often leads to physical symptoms, teeth grinding being one of them. The constant tension and apprehension can cause a person to grind their teeth, often during sleep. Hence, they might not be aware of this detrimental habit. Teeth grinding can be an unfortunate side effect of certain medications too. Antidepressants or psychotropic drugs can affect the muscular function and nerve signals of the jaw, leading to involuntary grinding or clenching. Always consult with your healthcare provider about these potential side effects when starting a new medication. It is key to be informed and prepared to manage such consequences. Lastly, grinding may arise from specific sleep disorders. Sleep apnea, for instance, is a condition where breathing repeatedly stops and starts during sleeping periods. When you have sleep apnea, the brain sends signals to the jaw to prevent the throat from closing, causing grinding. Other sleep disorders like insomnia and parasomnias can also result in similar problems. However, fear not, as your friendly dentist Clarissa has numerous solutions to help you handle this issue. Let's start with a simple yet effective method: jaw exercises. These are designed to strengthen your jaw muscles, increase flexibility, and reduce the frequency of your grinding. Not only do these exercises help physically, but they can also have a calming effect, reducing stress and anxiety, which are common causes of grinding. In conjunction with these exercises, a soft bite guard can work wonders too. This protective device is custom-made to fit your teeth perfectly. Wearing it at night will create a barrier between your upper and lower teeth, preventing them from grinding against each other. It also helps redistribute the force from grinding, thereby reducing the possibility of dental damage. Dentist Clarissa. Faith. I'll suggest some gentle jaw exercises and prescribe a soft bite guard for you to wear at night. This should help mitigate any further damage. This combined approach of exercises and the guard not only helps manage the current condition, but also prevents further damage to your oral health. During their conversation, Dentist Clarissa discovered that Faith was embroiled in an adverse workplace situation. This hostile environment was the root of her heightened stress levels, and consequently, this stress was negatively impacting her oral health. Dentist Clarissa, being not just a medical professional dealing with oral health, but also a compassionate listener, took the time to understand the nuances of Faith's situation. Faith, a diligent employee in her company, was contending with an aggressive, competitive atmosphere that was slowly eroding her peace of mind and overall well-being. The constant pressure to meet unrealistic deadlines, coupled with a lack of recognition and respect, had created a vicious cycle of negativity. This continuous stress was wreaking havoc not just on her emotional health, but it was also manifesting physically, primarily in the form of teeth grinding, a common symptom of stress. Dentist Clarissa, sensing the distress in Faith's voice and the anxiety etched in her demeanor, gently broached the subject of stress management. Clarissa was all too familiar with the repercussions of chronic stress on oral health. She had seen time and again how overlooked mental strain could lead to severe dental teeth grinding, also known as bruxism, was one such issue. It was a clear indication of the toll that stress was taking on Faith's body. Clarissa started by explaining the science behind it. Stress, she said, often leads to an involuntary action known as bruxism, a condition where individuals grind, gnash, or clench their teeth. This is commonly seen in people dealing with work-related stress. She noted that people might not even be aware they are doing it, particularly as it often occurs during sleep. However, the effects are very real and can be very damaging. In a nurturing tone, Clarissa offered the much-needed advice to Faith. She emphasized that managing stress was not a luxury, but a necessity. Clarissa suggested various potential coping mechanisms to alleviate the impact of stress. She mentioned the importance of regular exercise, deep breathing, and meditation, all of which could help her body to relax and reduce stress levels. She also discussed the benefits of therapy, explaining that talking to a professional can provide a different perspective and effective strategies to understand and handle stress better. She acknowledged that was not a one-size-fits-all solution, but it could offer invaluable insights into managing and reducing stress levels, thereby mitigating its physical symptoms like teeth grinding. Dentist Clarissa concluded, stress is a major teeth-grinding contributor. If your workplace is causing stress, it's crucial to find ways to manage it. This could involve exercise, relaxation techniques, or even seeking therapy. This conversation was a testament to the fact that holistic healthcare acknowledges the deep-seated connections between physical and mental health, and managing one can significantly help in maintaining the other. Faith took into account all of Dentist Clarissa's advice, obediently adhered to the recommended jaw exercises, wore the bite guard each night without fail, and also made the courageous decision to seek therapy to manage her escalating work stress. The jaw exercises in particular were a touch challenging initially, but Faith's determination and resilience outweighed any discomfort. She was dedicated to alleviating her pain. She performed these exercises with precision and regularity. Her jaw soon grew accustomed to the novel motions and movements. The bite guard took some getting used to. It was peculiar having a foreign object lodged in her mouth during her sleep. However, she realized how pivotal it was in preventing unconscious teeth grinding, which was exacerbating her jaw pain. It was an adjustment, but soon it became an integral part of her nightly routine. Then came the therapy sessions. At first she was apprehensive, unsure of what to anticipate. She was a bit skeptical, doubting whether talking about her work stress could help alleviate physical pain. But she was willing to give it a shot, and after several sessions, noticing a difference. The therapy sessions provided her with coping mechanisms, stress management techniques, and tools to prioritize her mental health. It was in these sessions that she learned that the mind and body are more interconnected than she'd ever imagined. It was a revelation, an eye-opener that changed her approach towards managing stress and pain. Faith would often reflect on the whole process, feeling a sense of accomplishment and gratitude. The decision to consult dentist Clarissa had indeed been the right one. The wisdom she had received from dentist Clarissa had changed her life. It was evident in the way her jaw pain had significantly decreased, and it was reflected in her overall quality of life. She was amazed at how much difference the right advice and guidance could make. Her life, her physical health, her mental health, all seemed to be on the rise. Her job stress, which was once a significant detriment to her well-being, was now a challenge she had learned to manage and overcome. Faith found herself one day sitting in dentist Clarissa's office, reflecting on her journey, brimming with gratitude. She leaned forward to Clarissa and said, "I'm relieved I consulted you, dentist Clarissa. Your advice has been invaluable. My jaw pain has significantly reduced, and my overall well-being has improved." Scene script. Narrator: if you're experiencing symptoms like jaw pain or suspect teeth grinding, don't delay seeing a dentist. We must keep in mind the importance of oral health and the role it plays in our overall well-being. Neglecting to address such symptoms might lead to severe consequences that could have been prevented with early intervention. Teeth grinding, also referred to as bruxism, is a condition that many people may not be aware they have. It often occurs during sleep, making it hard to recognize and diagnose without professional help. This condition can lead to discomfort in the jaw, headaches, tooth sensitivity, and even damaged teeth if left untreated. Jaw pain, on the other hand, might be indicative of several conditions such as TMJ disorder, sinus problems, tooth infection, or even heart disease. One key point to remember is that our oral health is not isolated from the rest of our body. Conditions like these could be a sign of stress, anxiety, or other underlying health issues. Therefore, seeing a dentist promptly when you experience such symptoms isn't merely about treating the symptom. It's about understanding the root cause. A dental professional possesses the necessary skills and tools to accurately diagnose your condition. Additionally, they can provide valuable advice on maintaining good oral hygiene, eating a balanced diet, and incorporating healthy habits into your everyday life. They can suggest the optimal treatment course based on your specific needs and condition. Maybe you're wondering how you can contribute beyond taking care of your own dental health. How can you make a difference to someone else who might be battling these symptoms? The answer is simple: awareness. Share your knowledge, educate others about the importance of dental health, and encourage them to seek professional help if they're struggling with any oral health concern. Our aim with this video is to not only provide you with useful information, but to create a community where everyone is mindful of their dental health. We hope that you'll share our vision and contribute to this cause in your own small way. Whether it's by sharing this video or by engaging in a conversation about dental health, every effort counts. ***, call to action. Did you find this video useful? Show your appreciation by liking, commenting, and subscribing for more dental health tips. If you know someone battling jaw pain or teeth grinding symptoms, don't hesitate to share this video with them.